Pregnant mothers have to walk or cycle for tens of kilometers to reach a hospital in Muranga County, and cases of pregnant mothers delivering by the wayside for lack of transport to hospital have been common here. This is a familiar story for too many women during childbirth and a dangerous fight for mother and baby to survive. However, their labor cries and those of other patients have been replaced by sirens of an innovative motorcycle ambulance. It's a simple design consisting of a metal frame constructed locally into a carriage that can hold one person lying down in a relatively comfortable position and pulled by a motorcycle. Community social workers who operate the ambulance Mashinani go where doctors can't, where hospitals are hard to find, where trained nurses are few. Good stuff. Today, they're visiting Margaret Wangeshe, a resident of Njiriaine Kandara constituency, for a routine checkup. Margaret is 8 months pregnant. The ambulance Mashinani is equipped with a simple and portable ultrasound device, which is mainly used to check the growth of the baby in the mother's womb. Community social workers have been trained to operate the ultrasound equipment.
Hii ni mara ya pili tumekuja kumwangalia. The first time tulikuwa tumemuona alikuwa miezi 7 na mtoto kichwa ilikuwa juu, alikuwa hajapenduka. Hii scanner huwa inatusaidia wakati kama huu, tunajua vile mtoto amekaa, ama ako sawa, ama anahitaji special attention. Huwa tuna record kila picha tunaweka, alafu pia tunatuma kwa printer, zinaprintiwa. Tukute mtoto ako vibaya ama hajajiposition vizuri, huwa tunampeleka hospitali kutumia ambulance Mashinani. The images tunazipelekea daktari ili aweze kuziangalia na ajue vile atakavyomsaidia zaidi.
Nimeona picha ya mtoto wangu na hana shida yote, nimefurahi. Anacheza vizuri. Pia heartbeat yake inapiga vizuri.
Mama wengi walikuwa wanaamua kupata watoto nyumbani, lakini na wakati mwingi unaona kama mtoto amekaa vibaya na mama hajui, yeye anakaa tu nyumbani. Kwa hivyo hiyo ilikuwa inachangia kifo ya mama ama pia ya mtoto ama wote wawili.
Ambulance Mashinani, a project by Ahadi Kenya Trust, is suitable for any kind of terrain.
The expectant mothers are able to get the services from their own, in their own homesteads, instead of course, most of them, as you realize, are very, very poor. They have no money. They don't even have any means of transport. And initially, they were being taken to hospitals by means of wheelbarrows, sacks, being carried at the back, others on a motorcycle, which is a very undignified means of transport. But now with the ambulance Mashinani, it's very dignified.
The motorcycle ambulance is reliable and serves hundreds of people. It can access many parts which vehicles have been unable to penetrate. Mothers can now get to hospital more easily, and trained teams riding the ambulance can go village to village giving care. The transport of pregnant women to the hospital has become less dangerous and faster. This improves their chance of survival, both for the women and for the unborn child. The ambulance Mashinani is fitted with a patient's bed, attendant's seat, and a first aid kit that contains, among other essentials, a delivery kit for pregnant mothers.
Moja, jioni.
Early this year, Eunice Mogore was in labor. She didn't have means to get to the hospital. She called the ambulance Mashinani, and within 10 minutes, the ambulance was at her homestay.
Kufika hapo Karati, hapo tu kwa reli hapo. Hapo sasa ndio tuliona sasa amesidika. Na nikamweka vizuri, na sababu tumefundishwa kusalisa, tukasalisa mama Jeri watoto wangapi? 2. 27 location Sakandara. Sababu mtu akigojeka napigiwa simu, naenda namchukua. Ikiwa ni mgonjwa, ikiwa mtu amefujika mguu, sana sana watu wa motorbike tumebeba sana na hii ambulance tukipeleka Marago.
Tuko hapa kwa boma ya
Monica Njeri, a mother of 5, is excited about the new service. She's expecting her 5th baby.
She has never gone to hospital before. She's in her 5th month, though according to her, she's saying the challenge that she's facing that is making her not go to the clinic is the distance. Hata alikuwa amepata hofu kidogo akatuita sababu alikuwa amesikia hachezi, lakini kulingana na the images tuna capture, mtoto ako sawa, the heartbeat is okay, amejiposition vizuri, the baby is doing well. This is her first scan. She's supposed to do three in the first trimester, the second and the third. But now she has entered the second trimester, she's doing the first one. But before she delivers, she's supposed to do another one.
This has just demystified ultrasound to make it available to all at the point of care. This is the way to go. If this was actually made available to all the setups at the very, very lowest level of medical, the impact will be tremendous.
Mothers have complained that their children have been exchanged and they're expecting a boy after visiting those traditional doctors, and then when they give birth to a girl, there's a problem. But right now, they're able to know even the sex of the baby before they go to hospital. So they are aware of what is happening and they are more informed of what steps to take and what to do.
Nataka ambulance iendelee na tuletewe ingine juu tukiwa wagonjwa wawili ama watatu hatuwezi pelekwa na ambulance moja.
Thanks to the portable ultrasound, a case of ectopic pregnancy was detected and early medical intervention was sought by the pregnant woman involved.
One of the biggest challenges is, first of all, people to accept that this thing can actually work, and also for other medical personnel to accept and see that this is not actually undermining their work. Is the cost of the ultrasound machine, because you know it costs almost 10% the value of the other hospital ultrasounds. So it's quite cheap, but at the village level, it's very, very expensive.
Niko na miaka ngapi? 33. Okay.
The portable ultrasound device has proven to have a massive impact. If pregnant mothers have knowledge about potential complications prior to birth, then they will make informed decisions of where to deliver their babies instead of discovering these conditions at the time of birth. Wangui, NTV, Kandara, in the county of Muranga.